Thanks for joining us, everyone. My name is Peter Starzynski. I'm the director of the Northwest Accountability Project. We are a watchdog organization that's dedicated to shining a light on the moneyed special interests that seek to bring an agenda of hate and division to Washington State. And today we're going to be talking with a very special guest who we're happy to have here, Didi Gray, who is a nurse in Southwest Washington. We're going to talk to her a little bit about the importance of safety measures around the coronavirus and what it means to healthcare workers, and why some of these fringe anti-union groups are trying to undermine these measures. And why that's an unfortunate thing. So Didi Gray, thanks for joining us. Didi is a nurse at Peace Health Southwest Medical Center in Vancouver, and a proud member of the Washington State Nurses Association. So thanks for joining us. And so tell us a little bit more about yourself and your family, where you live, those kinds of things.
Perfect. Yeah, so my name's Didi Gray, and I have worked at Peace Health Southwest Medical Center for 15 years, 12 of those being a registered nurse. I'm married to my husband, Joey, who is a union mechanical insulator, and we have two boys, Max, age 8, and Ben, age 6. So I love living in Vancouver, grew up here most of my life, and enjoy being a nurse.
That's awesome. And so both you and your husband have been out, working outside the house on the during this pandemic.
Yes, my husband's considered an essential worker, so he's been working on jobs such as building Tigard High School, and I'm considered frontline, being a labor and delivery. Right. Moms continue to have babies, so yeah, we've both been out working this whole time through the pandemic.
And tell us where in the hospital you work. Like what department do you work in?
Yes. So 12 years prior, I always worked as a float pool nurse. So I had worked in the ER and various areas. And last year I decided to take a job in labor and delivery. So now I'm a labor and delivery nurse helping moms and families have babies.
Awesome. And I should say I also have two kids, 5.5-year-old twins who were both born prematurely, and were in the ICU for 3.5 weeks. They ended up perfectly fine, but it was always like the nurses that were the most helpful. We barely interacted with the doctors at all, to be honest, when they were in there. It was nurses taking care of them and us, because as parents whose kids are going through that, you're in a pretty vulnerable state. So thanks for everything that you do, and nurses have a special place in my heart. So can you talk a little bit about how the pandemic has changed nursing, particularly in labor and delivery? Like, pandemic has changed childbirth in a lot of ways, right?
Totally, it has. So in the past, mothers could choose whoever they wanted to have as their labor support, whether they had a doula, their mother, their mother-in-law, their sister, their husband. So pretty much immediately after the pandemic started, we started, only allowing 2 visitors, and then pretty soon it was 1. So now mothers are faced with what support person they want to have in the room with them. And if they hired a doula, they might not even be able to have that support person be with them. So it's, caused a little bit of anxiety and fear. Plus, think about it. You're birthing a baby in the middle of a pandemic that we don't really know a lot about, how it affects children and adults, and, how scary could that be for them?
Yeah, and it's already a vulnerable time, especially if you have child born with complications like we had, or if there's any sort of issues there. So I can imagine there's a higher level of anxiety for folks. And how has the pandemic impacted you personally? Both you and your partner are frontline workers, essential workers. So how has it impacted you personally?
I just feel like we've had kids out of school, and we've just had to work hard just to continue to take good care of our patients and work our jobs. And we, it's scary to think, we have family that have underlying health conditions. So myself, frontline, being in the hospital, possibly being exposed, it's, we haven't seen family for a while, and just, not wanting to possibly hurt somebody from bringing
Right.
something from work. My husband's worked on job sites with a lot of, other coworkers. They take safety measures, but still, you just never know.
Right. And can you talk a little bit about the safety measures, what you do differently at the hospital now, how that impacts you personally, particularly around the big issue, and it shouldn't be an issue, but it's being manufactured as an issue, is wearing masks, and what that means to you as a nurse in your practice, but also in your personal life.
Yeah, so I would say that, luckily early on we started realizing the importance of wearing a mask. And now it's just a known fact that we're going to wear masks, we wash our hands, we get our temperature checked. And the idea of like the mask affecting like how I'm going to feel throughout my shift is really, if you talk to nurses that the last several years, let's say they've decided to decline to get a flu shot because they have an allergy or they had a bad reaction. These nurses have been wearing a mask for 12-hour shifts for 3 or 4 months during flu season for years and years and years, and they've never had any negative health impacts from it. One of my best friends declines the flu shot. She's had a reaction to it. She masks every time, every flu season for 3 or 4 months, and has not had any reactions or any kind of adverse reactions, I would say. So yeah, it's good to know that we have those safety measures in place to be able to protect our patients.
Right, and wearing a mask it's pretty simple, but there's a lot of misinformation out there that's made its way, into the internet. It's being pushed by organizations. It's even being pushed by certain political leaders. And so what's your reaction to this misinformation, particularly around masks, where, they're talking about oxygen intake or ridiculous things that aren't really based in any sort of science?
Right. Yeah. I mean, I just feel like it's just such propaganda, and to like really think about that, it just blows my mind as a nurse. And many of my other nursing colleagues have actually rebutted things like that on Facebook. And after 10 hours into their shift, they've checked their pulse oxygen and said, oh, look, 99%. I don't feel lightheaded. I feel great. I think it's fine to wear a mask. You're thinking, if I can do it for 12 and a half hours, you can do it while going to the grocery store or going to the park if you're not going to be 6 feet from someone. So yeah, I just feel like it's very much propaganda, and we're going to look back in 3 years from now and think, wow, people were really concerned about wearing masks versus being a really good community member and protecting each other. Because it's not necessarily about you, it's about the person's 90-year-old grandma that could be next to you in the grocery store or at the post office or whatever the errands that you have to go do.
Yeah, and I think this is ridiculous that we even have to say this, but you, in addition to being a healthcare worker, you also are raising a family, and you have to do your own grocery shopping, and you want to go out in the community, and your kids want to go to the park and all those things. So you're around other folks as well. You're not just in the hospital 24 hours a day. I mean, I'm sure you have really long shifts, but and so we need to protect, and so we need to protect everybody. We need to protect our healthcare workers who you may be next to at a grocery store, who later that day or the next day are going to be working with vulnerable people, or a mother having a child. And so it's incredibly important that you all are protected too, because as this virus spreads, it goes from one person to the next, and these masks are, we know, help slow down the transmission of the virus.
Yeah, I mean, I wish I could just talk to all the people that are really feeling anti-mask or like really believing into the assumption that it's going to affect their health. I wish I could just put them on my shoulder right here on one of my shifts and have them experience what I experienced by having a mom deliver a baby and see that brand new baby and be right there, giving care, and think in my head, oh, I didn't wear a mask last week. Could I possibly be hurting someone, when you're not? Yeah. So I just wish I could have that experience, and people might have a different view if they thought about, the spread and that everything that we have to do as community members to protect yourself and others.
Yeah, absolutely right. And so, I mean, what's your reaction to the misinformation, or what do you attribute the misinformation to?
I think that people are trying to make this political. Like they think that their rights being taken away from them. That's what I've heard and seen on some of like Facebook posts. And it's sad. I think it shouldn't be something political where, that your freedom's being taken away. I feel like people should stand up and be proud to try to want to protect each other and protect vulnerable populations and slow the spread. Let's get over this. Let's try to move past this and protect everybody.
Yeah, it seems simple, but unfortunately in this day and age, it's very politicized. I think you're absolutely right. It's just sort of partisan political hackery, and it's really unfortunate because people's lives are at stake. So you're a nurse. You're a proud union member. So you've probably heard at this point that a lot of these groups are pushing this misinformation are the same groups that are working to undermine unions. And one of those groups is the so-called Freedom Foundation, based in Olympia and funded by billionaires to try to destroy unions. They have been really pushing all the talking points on anti-COVID-19 stuff, including anti-masker work. They've now actually sued the state of Washington for the mask requirements that Governor Inslee implemented. So what's your take on a group like the so-called Freedom Foundation using this pandemic to push this political agenda?
Yeah, my take on that is it breaks my heart. I think it's very shameful. Again, those members or the people that are pushing those agendas on our community members, I wish are the ones I could bring with me.
Right.
A life of a nurse. I wish I could have them come to some of our WSNA members' jobs, in other units, and hear our nurses talk about how a patient can come in and be on oxygen, and then within 2 hours need a BiPAP, a machine, and then within 30 minutes be intubated, because that's happening up at my hospital frequently. So I really wish that they could see through the eyes of a nurse, our other healthcare workers, respiratory therapists, physicians, what we're dealing with, and that it breaks my heart. It's just very, very saddening that the Freedom Foundation would turn this into something like it is.
Yeah, and it's so simple. And I think oftentimes you talked about people being intubated in the hospital. We always say, well, there are only X percentage of people die, which is a ridiculous thing to think about, like only X percentage of people die from this. But there are a ton of other complications that happen. There's a really, really hard path for a lot of people that do recover and don't suffer the ultimate pain there. And I think nurses experience what that is firsthand. And unfortunately, people aren't talking about how real and severe this virus is. And so anything else you want to add about the, masks and the importance of masks and anything else on this topic?
I would just say, as far as nurses or any community member, is be a role model, wear your mask, really try to help slow the spread. And, I always just say, you teach your kids about role model behavior, wash your hands, wear your mask. Same thing should be for the community members, that we deal with, is just wear your mask to help.
Yeah. All right. Well, thank you for having this conversation with us today. My name's Peter again. I'm with the Northwest Accountability Project. This is Didi Gray, who is a nurse in labor and delivery in Vancouver, Washington. Thanks for joining us.
Thank you.
And if anyone wants more information on Northwest Accountability Project, you can go to our website, nwaccountabilityproject.com. Have a great day, everyone.